For protesters here, the death of George Floyd exposed deep racial inequalities in the US. But so has the COVID-19 pandemic. The Centers for Disease Control and Prevention says racial and ethnic minority groups are disproportionately impacted by the virus.
Everywhere in the country, African Americans are dying at COVID at rates that are far disproportionate to their population in those states or those cities. And that's a clear statement that Black lives don't matter.
Brownsville is a predominantly black neighborhood in New York's Brooklyn borough. A 2017 report found 40% of its population living in poverty. Each week, United for Brownsville and a coalition of other partners distributes essential goods to roughly 600 people. As well as food, it's now also providing personal protective equipment to the local community.
The overall coronavirus infection rate in New York is around 20%, but there are a number of hotspots across the city. Here in Brownsville, the infection rate is over 40%.
New York's Governor Andrew Cuomo says the virus didn't attack equally and hit low-income and minority areas the hardest. And he's vowed to add more COVID-19 testing sites to these neighborhoods.
We're not getting support. Nobody's standing up for us. I'm glad that the governor, is saying all of these great things on TV. But when it gets passed down, or how it gets passed down to the community, it's slow to come.
Officials are also promising to boost education and the availability of PPE and hand sanitizer in these communities. Some medical professionals say that while disasters may not create healthcare disparities, they do expose them.
The disparities and the systemic weaknesses that create vulnerabilities in communities of color for Black and Brown people, regardless of where they live, are going to manifest in critical and sometimes fatal ways during these types of crises.
Officials say they're committed to curbing the spread of COVID-19 in neighborhoods like Brownsville. But residents want to see more done to end broader inequalities that far predate the coronavirus pandemic. William Denslow, CGTN, New York.